I'm Jill Donnan. I'm one of the addiction nurses with Borders Addiction Service. I've been working here for just under 4 years. As part of my initial role, I was delivering the overdose prevention training. So when naloxone was introduced, it was a small add-on to the training we were already carrying out. The team that I work with have been enthusiastic from the start, and that's made it really easy to fit into our roles. Part of our role is to discuss harm reduction and overdose prevention, and to give people the tool to potentially save a life.
Being a support worker with the Borders Addiction Service, I'm working on the front line. Most of the time we're doing the training with families and service users. I feel that naloxone is great because it gives people a chance.
Hi, I'm Gemma, one of the nurses with the Borders Addiction Service. For us down in the Borders, it's been really easy to implement the Naloxone Programme due to having a really enthusiastic team of nurses and support workers. They've easily embedded this into their everyday practice, ensuring that training and supply is happening on a regular basis. We also make sure that we have a good relationship with other services in the Borders who are offering the naloxone training. As we are the source of supply, it is important to ensure that they have access to these kits at all times. For me, I just think it's just get as many kits out there as possible, working with the person at risk, and I have been trying to do a lot more sessions with friends and family. At times they feel quite helpless at supporting the person at risk, and it has been the feedback given from them that they feel a lot more empowered by having this kit, and hopefully feel they have the resources now to potentially save that person's life.
For me, hearing that a service user I've trained has gone on to use naloxone and save a life has made it all the more worthwhile. Naloxone's here to stay, and I'm pleased to be a part in its delivery.
I'm Debbie, one of the support workers at Borders Addiction Service. The first training that I took part in when I joined the team was the naloxone 2-day training for trainers, and since then it's been part of my everyday practice. The simple message is naloxone saves lives.
Hello, my name's Neil. I'm a nurse with an addiction service here in the Borders in Scotland. I've been working with naloxone over the last couple of years, and I now make it a pretty much an integral part of my practice. With being a treatment service, one of the things we do is we work with people who become dependent on opiates and then come into service looking for substitute prescriptions. One of the difficulties of that is we then become people who monitor people on prescriptions, and that can be quite difficult because patients a lot of the time can see us quite clearly as methadone police and people who just monitor prescriptions. Since the introduction of naloxone a couple of years ago, I've really felt that it can enhance the patient-nurse relationship and really make a therapeutic difference. I think when you're telling people that you have something that can potentially save their life or the life of a loved one, they really respect that, and it can make a big difference for folk. And I don't think when people come back, I don't think they should worry about their prescription being reduced or changed or anything with regards to that. I purely think it's about us working with them and being able to tell them that naloxone is about saving lives.